Good afternoon. Welcome to the daily briefing at the EMA office in St. Clair County, where I'm joined by Chairman Kern and Sam Bierman from the Health Department. Sorry we're late today, but it's been a day it's been busy. So Sam, why don't you start us off?
Okay. So as of today, 34,890 St. Clair County residents have been tested, which is an increase of 957, which I believe is one of the highest processed result days that we've had up to this point. We are at 3,792 positive test results, which is an increase of 84 from yesterday. And that does include both males and females from under the age of 10 up to their 90s. And for our daily positivity rate for the county, we are at 8.8%. We are at 31,098 negative test results and 152 deaths, so we are not adding any new additional deaths today. For those who have completed the IDPH required 14-day quarantine, we are at 2,719. For state totals, we are at 2,699,568 that have been tested, with 178,837 positive test results, which is an increase of 1,941 from yesterday. For deaths, the state is reporting 7,495, which is an increase of 21 from yesterday. And for hospitalization numbers, and these are for hospitals that are in St. Clair County, currently we have 36 patients that are admitted due to COVID-related reasons, and none of those patients are currently on ventilators. For congregate living facilities, and that is staff and or residents, 2 or more, that are either COVID positive or who have COVID-like symptoms that are in outbreak status, we have 3 changes today. The first facility is Autumn Meadows in Cahokia, which is now at 9 cases and no deaths. So that's an increase of 2 cases for that facility. Bria of Belleville is at 63 cases and 7 deaths, which is an increase of 1 case. And Caseyville Nursing and Rehab, which is at 8 cases and 0 deaths, which is an increase of 3 cases at that facility. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. You're working hard.
We are. Today, like I said, 957. I'm not a betting person, but I would say that's one of our highest, if not the highest day of processed results that we've had so far.
And I think we've had the highest week, 5,149
Quite a few tests
in the past week. Mm-hmm. It's our goal, to get up in that 5,000 range, and so we're there. Mm-hmm. Hopefully the state will come in and continue to be testing and help us out to achieve those numbers.
Yes.
Again today, 50% of the positives are individuals under 40.
Mm-hmm. And that's becoming the norm that we're seeing. That age bracket is becoming our highest rate.
Almost to the number every
mm-hmm.
day.
It really is. Yes.
It's very interesting. Our regional positivity rate, 7.7%. Mm-hmm. So we're still not to the 8% level that requires a rollback, but
still getting a little too close for comfort. For my liking, as we've said in the days past, it's not okay just to be under that cap. We want to be as close to 0 as we can.
And the way we get there?
The 3 W's.
And what are they?
Wear your mask. I don't know what the W's are. Wash your hands and socially distance.
Watch your distance.
Watch your distance. There you go.
Okay. I say that in my sleep.
Do you? You know it's bad when you're dreaming about this stuff.
Yeah.
Okay. Well, I dream about zip code reports, so we'll move into those right now. 62059, we went up today. We went up 1 to 10. 62201 went up 4 today to 181, and these are COVID positive diagnoses in these particular zip codes. 62203, we remained the same today at 151. In 62204, we went up by 6 today to 115. In 62205, we went up by 1 to 146. 62206, we went up by 2 to 334. 62207, we went up by 1 to 199. In 62208, we went up by 3 to 238. 62220, we went up by 10 to 302. In 62221, we went up by 13 to 334. 62223, we went up by 5 to 165. 62225, we remain the same today at 16. 62226, we went up by 9 to 395. 62232 went up by 3 to 83. 62239 went up by 3 to 44. 62240 remained the same at 14. 62243 remained the same at 26. In 62254, we went up by 2 today to 118. 62255 went up by 1 to 13. 62257 remained the same at 20. 62258 went up by 4 to 58. 62260 went up by 4 to 44. 62264 went up by 1 to 66. 62269 went up by 9 to 259. And 62285 went up by 2 to 34. A lot of zip codes on the increase side today. That we don't like to see that. So we're going to continue to be vigilant and wash our hands, wear our masks, and watch our distance. For the past 2 weeks now, we've been talking about schools and what's going to happen in the fall with our children going back to school today. One of the larger districts in St. Clair County. We're joined by Ryan Voigt, the superintendent of Belleville, District 118. Thanks for being here, Doctor.
Thank you, Chairman.
So, I guess we'll just dig right into it. Tell us about what the school year is going to look like for students in District 118.
Well, Chairman, since last spring when we found out we weren't coming back to school, we knew we had to have a pretty good plan to reopen this fall. And we had a lot of teachers, a lot of our employee groups have been talking all summer, working on a plan to get all our kids back. As more time went by and the number of parents who had requested to start the year with remote learning, we realized that our plan wasn't perfect. And when your plan's not perfect and you're dealing with people's health and safety, that is always a huge concern. So we released our return to school plan a couple weeks ago for feedback and discussion, and the number of parents who wanted their children to start remotely continued to increase. So this past Monday, we made an announcement that we were going to recommend to start the year with 100% of our students learning from home remotely.
And you're pre-K through 8.
Correct.
And so how will that look? So you'll be passing out Chromebooks and equipment?
Yes. The first thing I want to say is to all the moms and dads that this creates a hardship for, I am sorry. The last thing we ever want to do is create a tougher situation at home. But when we realized that our very best plan was to start remotely, we looked at what we could do better from the spring, and we are going to provide a device for every child in the home that needs one. And we also are going to provide internet services. We're working with a couple of providers. The district will lease hotspots so that each family will have a hotspot. We are focusing also on our meal distribution program to make sure that all of our boys and girls will get lunch and breakfast each day. And then also we're looking at how we can support mom and dad at home. One of the things we're planning to do, and normally a parent orientation where we have large groups of students and families come in and we talk to them about the school year. And this year we're going to focus more on a parent-teacher conference style where we can bring families in one at a time, or if we have to do a virtual conference and talk about what mom and dad can do to support virtual learning, how they can access Google Classroom or the platforms that we're presenting, and the different ways that we can communicate better if there are problems with that. The other thing that we're working on is a plan that some of our special needs kiddos that need therapy and different things, that we can bring them in on a limited basis, but still try to get them in the school to provide the services they need. And also we have optimism that we're going to be back at the beginning of the second quarter. So after the first 9 weeks is up, we are going to assess that every 3 to 4 weeks just to see if things have gotten better or that we need to look at extending that plan. But I speak for all of our teachers and administrators and everybody in the district, and we're disappointed that we can't see our kids walk through the door on that first day. This is supposed to be an exciting time of year where we're welcoming everybody back, and we're excited about a new year of learning. And while I truly believe it's going to be a good year, we're going to do everything we can to make sure our boys and girls get a great education. It's disappointing that they're not going to be in front of us every day, at least not for the first 9 weeks.
And these, you're making these decisions for the health and safety of your students. So you are not alone in making this decision that you're going to be solely remote for the first quarter. There are many districts that are doing that, and that's a good thing. So by doing this, are the lesson plans then going to be? Are the teachers going to be in the schools? Or are they right now recording their lesson plans? How will that look for a student who's going to start remote learning in August?
Our current plan is to have all of our staff members report to our buildings and to instruct virtually from their classroom. Unlike the spring, where there were specifics, but not in terms of our assignments were not graded and your work could only help your grade. We're having synchronous learning where there's a schedule of courses and what you're going to do that day. The assignments will be graded. We put a lot more structure into it to benefit all of our kids. At the same time, we understand we got to be flexible to help kiddos that might be in a tough situation.
So will your school hours be the same? Are they shortened? And can people or can students maybe access those classes rather than live? Are they recorded? Could they, if they have some situation where perhaps a high school student is there that's learning remotely also, and they only have so much room in the house that one could do their lessons and the next could wait a couple hours and get theirs done?
Currently, part of the instructional day and the day is condensed, but part of the instructional day is synchronous in that the teacher will be instructing directly. There will be opportunities for recorded videos. I know our grade levels have already started talking. Actually, I met with a group of kindergarten teachers, some virtually, some in person, to talk about how they can all support each other, even though they're not in the same buildings. But some of the lessons could be recorded. But there will be synchronous learning that's live every day. And then there will be follow-up activities, depending on the age of the student, that maybe mom or dad can support, or a sibling who is in high school. But it will look a lot different than it did in the spring.
Is there a bit of a worry that the way spring went, you were thrown into this? I mean, it was on a Friday you found out that you needed to go remote, and on Monday you had to provide the product. Is there a bit of a concern perhaps that some students are going to start in the next grade and yet maybe they didn't quite get everything they needed in the prior grade, that there are going to be some makeup work that's going to have to take place to bring everyone up to that grade level?
There's always that worry. One of the things that our teachers I know will do is try to assess students early in the year and figure out where we can meet them and how we can take them to the next level. I know with our younger age students, we do have some assessments and things and some activities where teachers will get an idea of if a kiddo's at level, if they're below level, or if they're advanced, and we want to try to meet every kid where they're at. There are some kids that forgot more about how to use their computer than I know, and then there are some kiddos that are still learning the basics. So I feel much more confident about the plan we have in place now than in the spring. One of the things I will say, and I'll give a shout out to Chris McMahon, who's our Director of Technology. He has been doing trainings for the past few weeks. Actually, he did them earlier in the summer about how to use Google Classroom, WeVideo, and a lot of different supplemental technology resources. So I feel much better about what we're going to be able to provide for our families now.
So I know 118 has a significant meal program. They provide breakfast for a lot of the students and lunches and even something to take home. How is that going to work? How's food service going to work?
We started in the spring when we found out that we were going to go remote. We had a bus route that every day delivered a breakfast lunch pack. And then we had a member of our transportation department tested positive, so that created a challenge with that system. But we're planning to go back to that, where we will run our bus routes every day once, and then parents can sign up for the 9 weeks to get it's a breakfast lunch pack, and it's a meal that can be heated up. Last spring we were a little bit more limited But I feel like the menu items are better, healthier for kids now. And we learned from the spring that it'll be more fine-tuned. But there's also a lunch period built into every student's schedule. And it centers around when that will be, the bus will come by their house. So we're trying to make it as much like a normal school day as possible. But we do understand there are going to be challenges for each and every family based on their situation.
Are those meals you prepare, that 118 prepares, or are those that they're bought commercially?
Our food service will put those packs together. Part of the pack is prepackaged, and some of the things are put together. But there will be an entree that does include vegetables that can be heated up at each household. That's more nutritious, I think, than the things we provided before. Although I will tell you, I saw the packs from the spring, and they look pretty good.
So, are there any things that you need from the parents? Should they be kind of setting up the house right now to get a certain environment for the student to learn in?
One of the things that we asked all of our parents to do is register this year online. That's new for our district. I sent out a reminder Monday that if they have not done that yet, to please do so that we can identify who needs a device, who needs a Chromebook. And I say Chromebook because that's the common device that we use in our district. It supports the Google Classroom platform. And then how many, so if there are multiple kids in their family that need one, we want to make sure every kid has one and they don't have to share that for their lessons. And then who needs internet accessibility? Because obviously you could have the best device, and if you don't have the internet, you're not going to be able to participate in the virtual lessons. Those two things first. We're tweaking our school supply list to support that. And then also we want to make sure that parents are able to participate in that orientation, so we can go over how the Google Classroom platform works. And one of the things we want to know about their concerns. I understand there are some people that are upset because they were really hoping their child was going to be in the classroom this year to start the year. And again, our goal is by the second quarter to get them back. But if there are concerns or barriers that are going to make this harder for them to work with their kiddo at home, we want to know what they are. We may not have the perfect solution for everyone, but we want to try to problem solve with them to try to help them out as much as possible, because we will be back with our kids, and we want to make sure that we're doing anything and everything for those children so that when they get back, they're where we need them to be. Obviously, I'll go back to your 3 W's so that we can make sure we get rid of this pandemic coronavirus situation as quick as possible. I mean, it's a situation that's unprecedented, that I know I never imagined in a million years we would have to deal with. And I will say this: we've had great support from the community. I know just the education world, the business world. Everybody has really reached out to us in an effort to support our kids and their learning. So, given the situation, I can't feel better about the support that's been in place.
So when is the orientation? Can they sign up? Should parents be signing their students up right now?
If they have not signed up, they can go to our website, bevel118.org, and if they have not signed up their child, they should contact their child's school. If they have any issues logging in, they can contact us at the central office. There's a help ticket on our website, or if they call their child's school, they'll facilitate that. But I know as of yesterday, we still had over 30% of our families, and we have over 3,800 students in our district, that still had to register online. But the 17th and 18th is our parent orientation days. The 20th is our first day of virtual school. But we want to make sure that we're putting everything in place to make sure that this is a successful experience for our kids. And we want to know if mom and dad are having issues, we want to try to help them as much as possible.
Great. Extracurricular activity?
You know, unfortunately, as a sports person myself, we had to suspend the fall sports for our district, and that was baseball, softball, and soccer. We did that. The Belfair Conference superintendents met a few weeks back and decided that in the best interest of the health and safety of all of our students and families, we were not going to hold our fall sports. We're going to assess well before our winter sports start. And usually they start early October, so we'll talk early September about the basketball season, volleyball seasons. But for the fall, we're not going to have any sports.
How about Mr. D and the music?
We're still having band. And they will do sectionals We're talking about options for kiddos to come in, do some of that stuff outside. We probably won't have a full band rehearsal or anything like that, but we will still have band. So the students that participate in that will still be able to do that, whether it's virtually. We've talked about some of the options, and also trying to get kids in on a limited basis in small groups or one-on-one.
Okay. Herb?
Well, Doctor, it's a pleasure to have you in, kind of shining some light on what's going on in our crazy world, and I'm glad to hear that it sounds like you and your staff have really thought this out. And I know you can't please everybody, but I think what the main thing is, it sounds like you've got the students' health and safety at the centerfold here, and I think that's what the parents are wanting to hear. So I applaud you for doing that.
Thanks, sir.
Brian, was there any other questions to come in?
No extra questions, just an overwhelming support for the decisions the district made. Parents recognizing it was a tough choice, encouraging both the staff and students to do the best to get through it and hopefully see each other in 9 weeks.
Well, one thing I will say is our return to school plan and our remote learning plan are both on our website, and there's a link that if you have any feedback. And again, we want to have a perfect plan in place, knowing that's not always possible, but if there's an idea or a suggestion, please let us know what that is. If there's a way to make it better, we want to know what it's going to be.
That's great.
Doctor, we sure appreciate
Thank you.
coming in
Thank you,
today.
Chairman.
Appreciate
Thank you,
the plan,
Appreciate it.
and keep up the good work.
Thank you.
Thank you.
Good. Well, Chairman, when I started off, we were late, and we apologize for that, but it's just been a crazy Friday around here and preparing for the weekend. But, conference call with IDPH. We're crunching the numbers, looking at them. It's that roller coaster. I mean, our positivity rate for the region is 7.7. And that's what we keep explaining, and I know every day we're getting more and more followers on the briefings here. So, that's the one I look at as the overall region, because that's what's going to trigger us to go back.
And how great is it that we've got a group of legislators, senators, representatives that get a call together on a Friday afternoon with the director of the Illinois Department of Public Health.
On a short notice.
Dr. Ezike on there, listening to our concerns, talking to us about how IDPH can enter the picture and see if they can help us with our numbers and figure out how to make our numbers go in the direction that we're seeking. I think all those recommendations, listening to them, hopefully they can help us with the additional testing that we're seeking. We really appreciate those efforts, especially that of Jay Hoffman putting that call together today.
Well, and I was really excited when I heard Dr. Ezike talking about, they're taking into consideration that we border Missouri, and we're trying to do similar, because it doesn't make sense to have one part of the region doing one thing and then another. So I think as we talk here this evening, we ask you, the followers, to spread the word, tell your friends, tell your neighbors. For any of the business owners out there, the last thing anybody wants to do, whether you're the mayor of the community, whether you're a city a community leader, nobody wants businesses to shut down again. We all want to see businesses open, and those businesses have to take responsibility. They have to make sure their customers are wearing the mask, they're practicing that social distancing, because if we don't, and if we hit that metric for those 3 days and we go backwards, then those are going to be the same business owners that's going to be complaining. So let's be proactive instead of reactive, and that's what we keep preaching every day. Step up to the plate. Let's hit a home run. Since there's not much baseball games being played nowadays, we'll play our own game, and let's everybody step up, and let's keep those numbers down. And again, it's nothing personal. What we share here is what we want everybody to do to make sure that we stay safe, and that's real simple. Wear your mask, wash your hands, and watch your social distancing. The 3 W's. If you can't do that, shame on you. So we'll be back here momentarily with Daisy to translate this into our Spanish community. Tomorrow we'll have a special guest on that has been a victim of the COVID-19, who is recovering, as well as some of her family members. So you don't want to miss that. For those of you who think it's a hoax, for those of you who think it's a conspiracy theory, join us tomorrow afternoon at 3:30.